Hi there, it's Karen and Helen here from Nurturing Nurses Infant Massage. We just wanted to have a chat to you today about eye care in newborns. It's very common for newborn babies to have what we call a blocked tear duct. And when babies have blocked tear ducts, their eyes can become a little bit sticky and a little bit crusty. And this can be quite easily managed at home and usually clears up itself. So we're just going to show you today some at-home remedies you can use in order to help your baby should they be experiencing a blocked tear duct and sticky eyes. Okay, so if your baby has got a blocked tear duct and has got sticky eyes, one thing that you can do at home is what we call eye toilets, or maybe you might call it an eye bath. And for this, we first need to always wash our hands before touching baby's eyes. We need either some saline solution, like a saltwater solution, which you can buy from your pharmacy, or you can boil some water, pour it into a clean vessel, and let that water cool down. You can also use just cool boiled water for the eyes as well. We need some little cotton wool balls, or you can use the cotton pads, whichever you've got at home. All right. If you do happen to have the vials of saline, you can just open that and you can squirt that onto the cotton wool balls. All right. If you've got, say, a bowl of cool boiled water, you can just dip your cotton wool into the cool boiled water. And then whichever eye is sticky, it could just be one or it could be both. You'll just take your cotton wool ball and you will wipe from the inside corner of the baby's eye to the outside just once and then discard that piece. If it needs a second wipe, do the same again, inside, out, and continue that process until the baby's eye is clean. Helen will now demonstrate to you a massage technique which can also help clear the blocked tear duct.
Thank you, Karen. So yes, as Karen said, always making sure that you wash your hands. It's very, very important that you don't introduce any infection into baby's eyes. Now, the other thing that's also very important here, because we're going to be going very close up to the inner part of the eye, is that you don't have any sharp nails. For this exercise, we're going to be using our pinky fingers on both sides of our hands here. And we're going to be going opposite hand to opposite eye each time. So holding nice and firmly and being directly above your baby, using your pinky finger, we're going to perform a little maneuver, and we're going to do this maneuver 3 times on each eye. So it's a firm downward stroke towards the top of the lip, 1, 2, with moderate pressure, so you should see the skin move on the face, and 3. We're then going to change hands to support our baby, and we're going to use the opposite finger again here, and we're going to go from the inside of the eye down, 1, 2, 3. And what we're doing here is we're trying to release the blocked tear duct, which lies exactly under there where I've just shown you. So we're going to do this maneuver 3 times a day, and you would combine that with the eye toilets or the Eyecare that Karen just showed you. When you've finished, wash your hands again. Okay, so now we've gone through the Eyecare with you. I just wanted to say that it's very important that if you don't think things are improving with your baby from doing the Eyecare, or you're worried that there's any signs of infection, the discharge has become quite green, then it's very, very important that you seek some advice from your GP or your health provider, child health nurse, if you have those concerns.